Welcome, future thinkers. This is Mark, and wow, my mind is still trying to wrap itself around what we're about to unpack today. It's something else.
And I'm Jenny, here to try and make sense of it with you, Mark. Because what we're talking about today sounds like it leaped straight out of some futuristic movie. I mean, what if I told everyone listening that computers are now being made with human brain cells, like actual living cells?
Right? It's not a drill, Jenny. This isn't science fiction anymore, it's happening. We're diving into Cortical Labs and their CL1 biological computer. You know, dubbed the world's first code-deployable biological computer. Quote, it's this wild concept of a commie, body in a box, integrating hundreds of thousands of lab-grown human neurons right there on a silicon chip. It's pretty wild.
Okay, wait, let me get this straight. So no longer just inspiration from the brain, but actual, living brain cells times inside a computer? What does that even mean for how it works? Like, how does that translate into processing power?
That's the truly fascinating part. So these neurons, we're talking about 800,000 of them, minimum, for the CL1. They're not just like static components. They transmit and receive electrical signals, forming these complex networks that process information. Kind of like a miniature brain here. There's two-way communication. Electrical impulses stimulate the neurons, and the system records their responses. It's a living, breathing circuit board almost.
And it comes with life support? Because brain cells need to, stay alive. Like, they're not just silicon, they're biological.
Exactly. It has a built-in life support system. Think of it like a tiny, sterile intensive care unit for brain cells. It regulates temperature, handles gas exchange, filters waste, everything needed to keep these neurons alive and firing for up to 6 months. And it's all in a self-contained unit that operates on its own, without needing an external computer for its basic functions.
6 months? That's quite a long time for living tissue outside a body. But if this thing is thinking, then what can it actually do? Can it, draft an email for me or run my spreadsheets?
Not quite your spreadsheets, Jenny. Unless your spreadsheets somehow learn from experience and adapt on their own. The big splash for their predecessor, the dish brain, was playing Pong. And here's the kicker, the amazing part. It learned to play Pong in 5 minutes.
5 minutes? Mark, my kids take longer than that just to find the power button on the console. How is that even possible? What kind of magic is this?
That's the wonder of biological intelligence, or what they're calling synthetic biological intelligence, SBI. These neurons don't need to be programmed in the traditional sense, like lines of code. They learn and adapt through something called Hebbian plasticity, which, at its simplest, means neurons that fire together, wire together. The system gives them electrical feedback, and they just organically figure it out. It's also energy efficient, operating at roughly 90% less energy than comparable silicon-based AI systems trying to do similar complex learning tasks. It's a completely different paradigm.
So learning without coding, that's a concept that takes some getting used to. And the cost? What's the price tag on a literal, thinking box like this?
They're priced at around $35,000 per unit. But here's where it gets even more interesting for accessibility. They're not just selling physical units. Cortical Labs is launching what they call Wetware as a Service, or WAS, later this year. So you can actually rent access to these biological computers in the cloud, just like you would any other cloud service. Wild, right?
Wetware as a service. I thought I'd heard every acronym in the cloud computing space. That's a new one. But beyond playing Pong, where is this actually useful? I mean, who exactly needs a brain in a box, really?
This is where it gets truly impactful, Jenny. One of the biggest applications right now is in drug discovery, particularly for neurological diseases. Listen to what Brett Kagan, Cortical Labs Chief Scientific Officer, actually said about this. The large majority of drugs for neurological and psychiatric diseases that enter clinical trial testing fail because there's so much more nuance when it comes to the brain. Quote, that's a powerful statement.
Yeah, over 90% fail, right? Because animal models, while helpful, don't quite capture human brain complexity in the same way.
Precisely. Now, with CL1, pharmaceutical companies can test drug compounds directly on human neural networks. We're talking about modeling diseases with human-specific accuracy for the first time. They've already identified epilepsy drug candidates that, get this, were missed by animal models, and they're talking about personalized medicine, where they could potentially use patient-derived neurons to test therapies specific to that individual. Imagine the possibilities for precision medicine.
That's huge. That could save billions in R&D and bring much-needed treatments to market so much faster. But, Mark, we've got to address the elephant in the room here. We're talking about human brain cells. The C word. Consciousness. Is this thing aware? Is it feeling something?
The big question. Cortical Labs is very clear on this. They say these systems are not conscious or self-aware, but are specialized computing substrates. Quote, they argue the neuron count is simply too low compared to a full human brain, which has billions. And they lack complex structures like the thalamocortical loops, which many neuroscientists believe are necessary for consciousness. So for now, they say no.
But ethicists are still having a field day with this, aren't they? If it's adapting, if it's error correcting, does that imply some rudimentary form of experience? Even if it's not full-blown consciousness, it's a slippery slope.
Absolutely. It's a huge ethical and philosophical debate, and frankly, our regulatory frameworks aren't built for this. We have rules for AI, and we have rules for human tissue research, but nothing for this unique fusion of the two. It's a regulatory black hole, and there are urgent calls for international ethical standards to address everything from donor consent for the cells to what happens if these systems get even more complex. But what if they grow in complexity? Where do we draw the line?
So we have a complex technological breakthrough that could revolutionize medicine, but it's sitting right on the edge of massive ethical and philosophical questions that we don't have answers for yet. It reminds me a bit of the early days of genetic engineering, where the tech moved so much faster than the regulations could keep up.
It's very much like that. And it's only going to accelerate. They've secured $11 million in funding, including from InQ Telephone, which is the CIA's venture arm. So, expect this to move beyond just pharma and into areas like next-gen AI and potentially even defense robotics. That's another layer of ethical concern, isn't it?
Intelligence agencies getting involved in brain-in-a-box tech, that raises a whole new set of questions, doesn't it? I mean, it's pretty wild to think about, but for now, the idea that we can rent actual, living brain power from the cloud, it's just something else. The future is here, and it's gooey.
It is, Jenny. And it's fascinating. Whether it's saving lives through drug discovery or pushing the boundaries of AI, the biological computer is going to force us to rethink what computing really is and what intelligence means. What an episode to unpack.
Definitely. I mean, it's hard to imagine what next season might bring if this is just 2025. This has been quite a journey. Thanks for joining us on this wild ride, everyone. We'll see you next time.
Bye for now.